I would like to thank the organizing committee for the invitation and to my colleagues, Professor Hess and Dr. Pecker, for being involved in this project about Globus, and my apologies for not being able to be here today. The following clip will demonstrate in an excellent way what we think is the origin of a globus.
Here's the scenario. Your new boss has asked you to write a presentation for him. The day of, he stands up and he says, "I'm so sorry, but I got to take care of something. Give the presentation. You are nervous." Perhaps a situation like this has happened to you before, where your negative emotions have been running high and you've had to speak. You've gotten all choked up, or you've begun talking about something emotional and you felt a lump in your throat. Chances are all of us here can relate to one of these scenarios because they are completely normal. Normal physiologic reactions to an emotionally threatening situation, either real or in our mind.
So the model is based on the 4 F's, state of mind of fear, anxiety, turns into an action, into fight, flight, or freeze. So basically it's a somatizing process. It can be conscious or it can be unconscious, and it ends up in increased tonus in pharyngeal muscles, and this is the feeling of globus. We have an issue with a contrary medical diagnosis of reflux, mucus, and postnasal drip, because we have a problem with the physiological understanding of those models. In this clip, we will see a typical complaint of a globus patient.
When I swallow, it's swollen. It feels like there's a big lump in the back of my throat. Mm-hmm. Sometimes when lying down, it can become very, very difficult to swallow. And if I swallow, I can feel like sometimes it's like a clicking in here. Mm-hmm. It gets painful if I talk too much.
Now, there is no doubt that we should eliminate any pathological processes which are causing potential globus. This is obvious. The problem is the elimination process takes a long time and it's quite complex. And what was interesting for us to find out that all this collection of procedures, there is only one small reference to physical examination, and even this is referred to as nasendoscope, as if nasendoscope is a physical examination. As I mentioned in the previous slide, there are 3 procedures which are missing in the elimination process of diagnosis and treatment of globus. The first one is observation, observing laryngeal function in swallowing and in speech. History taking, which is including medical history and maybe looking for psychological triggers which are associated with the onset of the symptoms of globus. And last and most important one is examination by palpation of laryngeal musculature, both static examination and dynamic examination, according to some rational protocol, which I will show later. This is a nice example of observation of a globus patient, and one can see an asymmetry in tension in laryngeal musculature, which is one of the 3 procedures which are missing in the elimination process. Here I would like to share with you some of the psychological mechanisms that we found were associated with the onset of globus symptoms. Identification, it means that the patient is taking on themselves the symptoms. Let's say a patient who is very anxious about a cancer that was found on his relative, a friend, and they begin to feel the same sensation in the throat in identification. Unconscious or conscious psychic conflict, somebody who, let's say, has to carry on doing some voice work, but they don't like it, they have to do it, and they are in constant conflict, and that is being somatized to the throat. Denial mechanisms, the patient feels some sensations, they don't know what it is, and the anxiety is not being elevated by the elimination process, and they are denying. When you ask them what is the problem, they say, no, I'm not worried, but you still come to the clinic to resolve this feeling of tightness in the throat. Post-traumatic stress disorder, let's say a conscious or unconscious episode in the past of drowning, of airways interference, can cause globus symptoms. Throat clearing by itself is very aggressive and is very irritating, and that by itself can cause increased laryngeal tonus and results in globus. Hypochondria, every little sensation in the throat turns into a lump, which is driven by anxiety. Resistant to change, patients who really are sure that something is wrong with them, but the doctors are failing to discover what it is, and they reject the professional's opinion, and they are running circles in order to resolve something which bothers them. And obsessive thoughts, and they are preoccupied with any body sensations. So far I was talking about the need for observation and a good history taking with a focus on possible psychological reasons behind the symptoms. And the last and most important aspect of the examination is physical examination by palpation. I have developed a very specific protocol for all the structures which are associated with laryngeal muscles and associated muscles, and the examination is straightforward, and the whole process which is described in this protocol takes about 2 to 3 minutes, and it reveals a lot of useful information for the diagnosis and treatment plan. So this is a video that shows the physical examination by palpation of a typical globus patient.
We try to move it from side to side. It's not very mobile, and it's more tight when we try to push it to the right than the left. You said that that's where you feel the lump?
Yeah.
That's there. Your middle constrictor muscle is quite tight. How does that feel? Okay. Do you feel any aches or pains around there?
It's kind of achy. I can handle it though.
Okay. My finger is now rolling on the thyroid muscle. The distance between the hyoid and the thyroid very minimal. Give me a nice yawn. And there is very little change in the gap there, which means that you're constantly holding it tight. Now moving the lines from side to side, there is a bit of movement. Now this is the psychotherapist joint.
Right.
Do you feel any aches or pains there?
Yeah.
Give me a nice sigh of relief. Lovely. And squeeze.
Okay.
Okay, you find good movements there.
And this is a typical treatment, and the patients respond. Explains about globus behind the cricothyroid. The crico and the hyoid relatively low. How are we doing?
This is more or less not very
Nice. Are you okay?
Yeah, I'm just trying to swallow, and yeah, it's very easy. Much easier, much different. Yeah, that's a huge difference.
That if you want to target a specific muscle, you have to know the origin, the insertion, the direction of the fibers, and what you need to fix. And that's the difference between that and what I call a non-specific massage.
How do you make sure that you stretch the inner muscle and not the skin?
Because you can see that there is no movement against the skin, but I can feel the larynx rising. Change. Swallow again.
Yeah, it's perfect. It's much softer, much smoother. It's perfect.
And if you do it right, sometimes the first swallow will be difficult. Here on the left, you can see the group of muscles which we can target, the floor of the mouth, the suprahyoid muscles, the pharynx, superior, middle, and the inferior constrictor, the thyrohyoid, and of course other suspensory muscles of the larynx. They are pretty big and very, very powerful muscles. In this video I will show how I reach the pharyngeal wall. In this particular example it will be the middle constrictor, the inferior constrictor, all the way down to the cricopharyngeus, and we will start with the right side of the pharynx, and then we will move to the left side of the pharynx. So you can see here I'm moving it laterally to prepare it to rotate it, and in a minute I will rotate it anti-clockwise. That will expose the right pharyngeal wall, here middle and inferior constrictor. You can see the finger is denting and stretching that part of the pharynx in a very powerful way. Also there is an impact on the airy epiglottic fold and the arytenoid. With this maneuver you can palpate and articulate very specifically the internal pharyngeal muscles and joints. Now I will do the same. I will rotate the larynx clockwise in order to expose the left pharyngeal wall, and again same stretching, and the left side here is much tighter than the right one, and this is very specific, very useful treatment. Here I would like to complete the picture about the typical globus patient by mentioning some of the associated symptoms which are very closely related. These are throat clearing. Throat clearing by itself is a vicious circle, and I think it's a self-inflicting problem. The patient is clearing and causing chronic irritation. He wants to clear the irritation, but further throat clearing. And here the solution is to stop throat clearing at any price. Difficulty swallowing, again, this is because of increased tonus in the laryngeal muscles, and it's part and parcel of what we achieve when we are treating globus physically. Aches and pains, non-specific. Normally the patient will target the insertion of the thyrohyoid muscle, very typical, and that can be palpated, identified, and be released like any other muscle in the larynx. Burning sensation, which are not caused by laryngeal LPR. Again, this is because of increased muscle tone, maybe mouth breathing, not LPR. Excessive mucus, this is a feeling that the patient feels, and again I think it's a derivative, a result of difficulty swallowing in the first place. And breathing difficulties, again this is anxiety caused, a restriction in the airways, and all related to some unconscious probably anxiety. Now it's important for me to explain that all our patients that are being discussed here underwent the full elimination procedures, and sometimes unfortunately they're coming after more than a year, have been through a long period of taking PPIs without help, and of course the length of time that it takes from the onset of symptoms until they come for proper diagnosis and treatment is by itself a big problem for us. And last and for all our patients and long courses of PPI with no effect. Going back to the violence of throat clearing, this is a high-speed video just to show the impact of coughing on laryngeal muscles. Needless to say, you can see the violence of the impact of the tissue. In summary of my lecture, the take-home message is that our working hypothesis is that globus is a psychosomatic disorder. It is caused by some psychological state of mind, either anxiety, conflict, which I've mentioned before, that leads to by somatization into increased laryngeal muscle tone, which is felt by the patient as globus. Now, it is not a reflux, mucus, or postnasal drip as the medics diagnose it for, because I'm very happy to discuss why physiologically those diagnoses have a bit of a problem to prove. I would like just to sum up and to suggest that the treatment for globus is very appropriate for trained people for the following reasons. They see the patient in a different context, meaning in a much more relaxed, less formal setup, and they can then feel free to talk about things that they feel they cannot present to their consultant, doctor. It is also of normal medical setup, more relaxed, and it takes much longer than a normal consultation. They spend longer with the patient and they have time to observe all the things that we were talking about. They take a comprehensive, they have the time to take comprehensive history and wait for the drop penny, and the patient will reveal eventually the real reasons behind their anxiety. They have time for physical examination of laryngeal muscles, and the physical treatment is applied there and then. The time factor here is very important. Thank you for your time and your attention.